is the Emergency Medical Minute.
Okay, so I always love studies that confirm things we already know. Makes us happy. You guys probably don't know, but any of the providers here do. Whenever we re-credential, we get this huge packet of redundant paperwork we have to fill out, and then we get this test that we have to take about procedural sedation, including all these arcane kind of fasting guidelines. Why we have to do that is kind of a long bureaucratic story, but it happens at a lot of hospitals. So how long are people supposed to wait or supposed to fast before procedural sedation? If you look at the American Society of Anesthesiologists guidelines, they have guidelines that say, especially when you look at, say, pediatric sedation, a minimum of 2 hours for clear liquids, 4 hours for thin formula, 6 hours for thicker formula, and 8 hours for solid foods. We know anecdotally, if you want to call doing hundreds of thousands of safe procedural sedations anecdotally, that it's rare that patients are fasting, and it's rare that they have complications. So there's a study called the Canadian Cohort Study for Procedural Sedations, and it was actually in kids, looked at 6,300 procedural sedations, and only 50% of them, so the way they set up the study was half of them followed the fasting guidelines, and the other half totally willy-nilly didn't follow the fasting guidelines at all. First of all, they looked mainly at vomiting, and in vomiting there was absolutely zero relation to fasting for who vomited. 6,000 sedations, 6 episodes of vomiting during the procedure itself, 300 episodes of what they called periprocedural vomiting, which is usually 20 or 30 minutes later as they're waking up. All of those that happen to be with ketamine. 0 of them had aspiration, so no real complications. And then when they looked at other complications of sedation, 0 correlation to any kind of fasting at all for any complications. So I always like these kind of studies. You can use it to kind of wave in the face of committee meetings you have to go to show them that what we do is safe and we're good at it, and to try to get out of having to continue to do kind of jump through hoops, kind of bureaucratic things. But just always fun to kind of reinforce what you already know.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.